Hi, I'm Dr. El-Ghazawi. I'm an orthopedic sports medicine surgeon with more than 10 years of experience diagnosing, treating, and getting people back to doing what they love with rotator cuff tears. There's a lot of misinformation about rotator cuff tears that can be confusing out there on the internet. So I wanted to make this video to provide a little bit more information about how we diagnose rotator cuff tears and treatment options that you might have. So in this video, I will talk about the most common reasons people get rotator cuff tears, how we diagnose them, treatment options that are out there right now for rotator cuff tears. What is the rotator cuff? Rotator cuff is 4 tendons around the shoulder that help move your shoulder in all directions. They kind of function in the mid-range and again, help move your shoulder in every direction. So when we make a diagnosis of a rotator cuff tear, we try to understand how much of the tendon is torn. And again, is it a traumatic tear or is it a traumatic tear? The rotator cuff tears are actually pretty common in the general population. Most commonly, they're either traumatic or atraumatic, meaning you had a big event, you fell, you got some sort of injury that caused the rotator cuff tear. We deem those as acute traumatic tears. And those are most commonly treated with a surgery if the tendon tear is big enough. The other way that people have rotator cuff tears is atraumatic, or they partially tear over time. We tend to see these in the older population. Common symptoms of rotator cuff tears are pain with overhead activity, weakness, pain that wakes you from sleep at night, and inability to participate in activities that you used to be able to participate in. A lot of times we'll get x-rays to understand what the bony pathology may be in your shoulder, but then ultimately an MRI is going to be the most helpful tool for us to understand what's going on with that rotator cuff. Is it torn, partially torn? Is there something else going on in the shoulder that could be causing your pain? If it's a partial rotator cuff tendon tear, meaning 50% or less of the tendon is torn, for me, a lot of times what I do is I try to treat that conservatively. Conservative treatment for me includes anti-inflammatories, rest, physical therapy, and sometimes we talk about different kinds of injections. Cortisone injections or steroid injections can help decrease inflammation and around the rotator cuff tendons and can help you progress with physical therapy. People are also trying what's called platelet-rich plasma or PRP injections. This is showing a little bit of promise as far as helping with pain control and again, aiding in the physical therapy and recovery of a partial rotator cuff tear. If you have a full thickness rotator cuff tear, meaning the whole tendon is popped off the bone and sometimes they retract, then we start talking about surgical options. If it's an acute tear, a lot of times what we're trying to do is go in arthroscopically, meaning a couple poke holes around the shoulder, we put a camera in, use our tools and try to repair that tendon back down to the bone. If it's a chronic tear, someone maybe a little bit older in age that has had this tear for a long time, what happens is the tendon itself and the muscle attached to that tendon start to weaken and become atrophied. In that scenario, especially in the older population, this is aimed at eliminating the rotator cuff or the need for a rotator cuff. Because what we've learned with time is that if you take a very old tear and a muscle that has fatty atrophy in it and try to repair it back down to the bone, it tends to not heal. So we are trying to prevent multiple surgeries. And we know that a reverse total shoulder has very good outcomes for the older population. Ultimately, no matter what you choose and how you choose to approach this, whether it's conservatively or with an operative treatment, physical therapy is an integral part of you getting better. So you'll have to really put in the work to make sure that your recovery goes smoothly with physical therapy. If you've liked this video, feel free to like and subscribe. If you have any questions, feel free to comment, send me an email, or make an appointment at the office to see me in person.